Most people believe a stroke happens suddenly, without warning. One moment you feel fine, and the next, everything changes. But, in reality, your body often sends signals long before that moment arrives. My name is Dr. Catherine Blake, and after more than 2 decades in clinical practice, I've seen a pattern repeat itself again and again. Patients arrive after a stroke and tell me they felt off for weeks, sometimes months, but didn't think it meant anything serious. What I've learned is this: the body rarely stays silent. It speaks early, but it speaks quietly. Today, I want to show you something most people miss. Your body often begins signaling risk before a stroke occurs, and those signals are not hidden. They are small, subtle, and easy to dismiss. But once you understand them, they become clear. Just a few weeks ago, I saw a patient, a 62-year-old man, active, independent, no major complaints. He told me he had been feeling occasional dizziness and a strange heaviness in his arm. He assumed it was fatigue. 2 weeks later, he had a minor stroke. When we looked back, the warning signs were all there. He simply didn't recognize them. So today, I'm going to walk you through 9 things your body may do before a stroke. For each one, I'll explain what most people assume it is, what is actually happening inside your body, and one simple habit that can help reduce your risk. The first sign is something many people experience and dismiss almost instantly: sudden dizziness or loss of balance. Most people assume this is just standing up too quickly or being slightly dehydrated. And sometimes that is exactly what it is. But when dizziness happens without a clear reason or starts occurring more frequently, it can be something else entirely. What's actually happening is a temporary reduction in blood flow to parts of the brain responsible for balance and coordination. The brain depends on a constant supply of oxygen-rich blood. When that supply becomes inconsistent, even briefly, the systems that control balance begin to misfire. Think of your brain like a control tower at an airport. It manages multiple signals at once, keeping everything coordinated. If power to that tower flickers, even for a moment, communication breaks down. Planes don't crash immediately, but the system becomes unstable. Research shows that transient ischemic attacks, often called mini-strokes, can present as brief episodes of dizziness. These are early warnings, not random events. A simple habit that can help here is maintaining steady hydration and avoiding sudden position changes. But more importantly, recurring unexplained dizziness should never be ignored. The next sign is where many people start to underestimate the seriousness: temporary weakness in one side of the body. Most people assume this is muscle fatigue or sleeping in an awkward position. They might say their arm just felt heavy or their leg didn't feel as strong. But what's actually happening can be a disruption in the brain's motor control signals. The brain sends instructions to your muscles through nerve pathways. If blood flow is reduced, those signals weaken. Imagine a power cable supplying electricity to a machine. When the current drops, the machine doesn't stop instantly. It slows, struggles, and becomes less responsive. That heaviness is your body telling you something is interfering with communication between your brain and muscles. Studies show that one-sided weakness is one of the most common early indicators of stroke risk. A practical step is paying attention to asymmetry. If one side feels consistently different from the other, it deserves attention, even if it seems mild. But this is where it becomes more subtle. The third sign is often ignored completely: brief changes in vision. People often assume blurred vision is due to tired eyes, screen use, or aging. They may notice moments where their vision dims, doubles, or becomes unclear, then returns to normal. What's actually happening is reduced blood flow to the visual centers of the brain or the eyes themselves. Vision relies on precise, uninterrupted signals. Even a short disruption can create noticeable changes. Think of it like a video stream losing connection. The image doesn't disappear completely, but it becomes distorted, delayed, or unstable. Clinical studies have shown that temporary vision disturbances can precede strokes, particularly when they affect one eye or one side of the visual field. If this happens repeatedly, it is not just an eye issue, it is a signal from the brain's circulation system. The next sign is where things begin to escalate. Sudden difficulty speaking or finding words. Most people assume they are just tired or distracted. They may struggle to recall a word or feel like their speech is slightly off. But speech is a highly coordinated brain function. It requires multiple regions working together. When blood flow is compromised, that coordination breaks down. It's like a team trying to work together with a weak signal connection. Messages get delayed, mixed up, or lost. Research consistently shows that speech disturbances are among the most reliable early indicators of stroke risk. A simple habit is to pay attention to sudden changes in communication. If speech becomes noticeably different, even briefly, it should not be ignored. At this point, I want to pause for a moment. If you've recognized even one of these signs in yourself or someone close to you, take a second and type yes in the comments. This helps more people see information like this, and it helps others realize they are not alone in noticing these changes. Let's continue. The fifth sign is often mistaken for stress. Sudden, severe headaches without a clear cause. Most people assume headaches are related to tension, dehydration, or lack of sleep. And often they are. But when a headache appears suddenly and feels different from usual, it can signal something more serious. What's happening is a change in blood pressure or blood flow within the brain. This can create pressure or irritation in sensitive areas. Think of it like a pipe system under stress. When pressure builds unexpectedly, it creates strain along the walls. Certain types of strokes, especially hemorrhagic strokes, are often preceded by sudden, intense headaches. A practical step is noticing patterns. If a headache feels unusual in intensity or location, it should be taken seriously. The sixth sign is more gradual, but just as important. Unusual fatigue or sudden drop in energy. People often assume this is just part of aging or a busy day. But when fatigue appears suddenly and feels disproportionate, it can be linked to circulation changes. The brain consumes a large amount of energy. When blood flow becomes less efficient, energy levels drop. It's like a city experiencing a power shortage. Systems continue to run, but everything slows down. Some studies suggest that unexplained fatigue can precede cardiovascular events, including strokes. A helpful habit is maintaining consistent daily activity and monitoring sudden changes in energy levels. The seventh sign is one many people misinterpret: numbness or tingling, especially on one side of the body. This is often dismissed as poor circulation or temporary nerve pressure, but when it occurs without a clear cause, it may indicate reduced blood flow affecting sensory nerves. Imagine a phone line with interference. The message still gets through, but it becomes distorted. That distortion is what creates the tingling sensation. This symptom is widely recognized in medical literature as an early warning sign. Daily movement, such as walking, helps maintain circulation, but persistent symptoms should always be evaluated. The eighth sign is more advanced: confusion or difficulty understanding simple information. People often attribute this to distraction or fatigue. But when confusion appears suddenly, it can signal impaired brain function due to reduced blood flow. The brain relies on constant communication between regions. When that communication is disrupted, clarity is lost. It's like a network experiencing signal delays. Information is still there, but it becomes harder to process. This symptom is particularly important because it reflects deeper neurological involvement. Maintaining mental activity and staying socially engaged supports brain health, but sudden confusion should never be ignored. The ninth and final sign is one that often goes unnoticed entirely: short episodes of coordination problems. This might look like dropping objects, misjudging distances, or feeling slightly unsteady. Most people assume clumsiness or distraction. but coordination is controlled by precise brain signals. When those signals are disrupted, even briefly, coordination suffers. Think of it like a timing issue in a machine. The parts are all there, but they are no longer moving in sync. These small coordination issues can be early indicators of larger problems. Regular physical activity and balance exercises can help, but consistent changes should be evaluated. In some cases, certain supplements like magnesium or omega-3 fatty acids may support overall vascular and nerve health. They are not solutions on their own, but they can help alongside a balanced diet and healthy lifestyle. It is important to consult a doctor before starting any supplement, especially if you are taking other medications. What ties all of these signs together is one central idea. The body does not fail suddenly. It gives signals, it shows patterns, it creates small disruptions before larger ones occur. A stroke is often the final result of processes that have been building over time. When you understand these early signals, you gain something very important: time. Time to act. Time to adjust. Time to prevent. We've covered 9 signs today, and each one represents an opportunity to notice something early. Now you know what to look for. So here's one simple step you can take today. Pay attention. Notice changes in your body, even small ones. If something feels different, consistent, or unexplained, take it seriously. You don't need to panic, but you do need to observe. And if you found this helpful, consider subscribing for more clear, practical insights, and leave a comment to share your thoughts or experiences. You can also share this with someone close to you. It may help them notice something they would otherwise ignore. Goodbye and see you soon.